Yeah.
Okay, hi everyone who are currently in here. We're going to wait a few more minutes and then we're going to get started. Hey, hi everyone. Welcome to the program. I'm so happy that you are joining us here tonight for this very important topic. My name is Dr. Vanessa Pomerico Danino, and I'm a family nurse practitioner. I work in primary care. I'm also the lead clinician for diversity, equity, inclusion, and belonging for the Connecticut Medical Group, Northeast Medical Group in Connecticut. And I'm also faculty for the Fitzgerald Health Education Associates by Calibri. I am so excited tonight to be having my guest, Jillian Ferragudo, with me. Welcome, Jill. Please tell the audience a little bit about yourself.
Hi, hello, good evening, everyone. My name's Jill. I'm a new graduate family nurse practitioner. I graduated last year, in August of 2023, and I'm so excited to be here.
Good. Well, thank you. It's so good to be working with you again.
Yes.
Full transparency, Jill and I actually spent 2 semesters together when she did 2 of her primary care rotations with me in my office. And when we were talking about putting together this podcast or this webinar, I thought she would be a great person to talk to because being a year out of her program and now, getting into her second year of practice, I thought that she would bring a lot of wisdom to our talk tonight. So I'm gonna be asking her a lot of questions, but as a reminder, I would like all of you to make sure that you put your questions in the Q&A. And at the very end, we'll address all of the questions there for you. So thanks so much, everybody, for being here. Hi, Jana. All right, so Jill, I know that when we were working together, you worked in the ICU for many years, and then you left the ICU and went on to become a school nurse. What was that defining moment that made you decide you wanted to pursue nurse practitioner education?
It definitely was when I was working at the hospital, as a bedside nurse, especially working in the ICU. You're very involved in your patients' care and their plan. And I just felt that I had room for growth with my patients' care. I felt that I could help, make their decisions to help with their treatment outcomes. I also knew within nursing in general, I wanted to um, move forward and build in my career. And I felt that I was growing outside of the hospital. And I just felt, let me pursue a general family nurse practitioner degree. And it was a very, very easy and smart choice.
Well, I agree that it was a smart choice for you. So you had mentioned that you graduated. It's actually almost exactly a year ago that you passed your
I
board, right? Didn't you say
know.
August 30th of last year? That's
August 30th.
fantastic.
I'll never forget.
So looking back from when you finished school, what do you think are the most critical clinical skills that new nurse practitioners should focus on developing to help them excel in their roles when they're just starting out as a new nurse practitioner?
This question is so easy for me to say. It's definitely getting a good history on a patient, just making sure you have those foundational skills of being able to gather a full history, gather their story, hear, what's going on with them, what their concern is, what makes it better, what makes it worse. And you find so many answers to your differential diagnosis in your plan just from their history before you even go, to do a physical exam. Um, and then of course, just learning your normals within a physical exam, because you don't need to know everything that's abnormal. You just need to know that it's not normal. And so what are you going to do? What's the next step that you're going to take?
Exactly. I remember my preceptor saying to me, if you listen long enough, your patient's going to tell you exactly what's wrong with them.
A hundred
And that was
percent.
pre-Google.
Mm-hmm. A hundred
So
percent.
when we think about how new nurse practitioners are starting, how can they effectively bridge the gap from their nursing role to their nurse practitioner role, especially when we think about the autonomy and decision making skills? I know that that's always something that I would see with students that at some point in their nurse practitioner education, they started to think like nurse practitioners when they were on the floor as a nurse.
Mm-hmm.
How do you feel that nurse practitioners can bridge that gap when you're transitioning from RN to NP, again, with decision making and autonomy?
Yeah, yeah. A big gap that I found personally was just that, as a bedside nurse, as a registered nurse, you're very task oriented. You're completing each task and moving on to the next item. Whereas as a nurse practitioner, you're really thinking about the whole picture, how this medication is going to affect your patient, not only right now in the moment, but a couple months down the road, what's their long-term plan for whatever they're coming in to talk to you about. And I think the biggest, bridge is also just recognizing the fact that you don't need to have all the answers. You're never going to know exactly what test to order. You're never going to know exactly what their outcome, might be. But it's really just how to find the answer. Having those people to rely on and to help support you, that will help you kind of connect the dots, in their big picture plan rather than, zoning in on the acute item that you're dealing with.
That's so true. And I remember Dr. Fitzgerald always used to say, you don't have to have all the answers, but you need to know where you can find them.
Mm-hmm. Mm-hmm.
So when you look back at a year ago and starting your new job, and I remember we had talked right before you were starting your new job, how do you feel your skills have improved from that first week on the job until now?
I think it's becoming more comfortable. I think the repetition of it definitely, makes you more comfortable in the field. I think that just time alone has, exposed me to different diagnoses, has exposed me to different plans that just make me more comfortable. Going over guidelines and protocols just to make sure I'm staying on track with, what's in the now. And I think it's really just time.
So just really being there and just being the constant exposure really improves your comfort level as well.
Totally, totally. Because of course, once you're treating one thing and then a patient comes in describing the exact same thing that you might have heard, a patient from last week about, you're like, oh, you know what? Okay, I'm going to order this set of labs, or I'm going to order this ultrasound, and then we'll go from there and come up with our plan because, you just, like I said, getting comfortable with the common diseases that you're going to see. And then of course, asking for help if you need it.
Right. And in terms of the autonomy, I remember, and again, it's been 26 years since I was out, but there's certain things that stick with you.
Hmm.
When was it that you started to feel like, okay, the buck stops with me? There's nobody above me who's going to be watching what I'm doing or helping me make my decisions. How do you feel about the autonomy that you have as a nurse practitioner versus an RN?
Totally. It's difficult. It's something that I'm still dealing with, even a year out from just practicing on my own as a nurse practitioner. I think it's just, I mean, I remember an exact moment. I was in a patient's room and I didn't know exactly what to do next. So I left the room and I was going to talk to one of the surgeons who I work with, and they weren't available. And so I was like, okay, so it's just me and I have to come up with a plan. What am I going to do? And I came up with what I thought was best. I told the patient that I would contact them if the plan changed at all. And, of course, always relying on support, but just I think having confidence in yourself that, I prepared very uh, much to get to the point where I'm at. I studied so much, and my program prepared me, my boards prepared me, and so I could make a decision. So I kind of was forced in a moment to, find that confidence in myself.
And how did that make you feel once you realized there's nobody there that I can ask and you had to rely on yourself? You had to feel somewhat proud of yourself for being able to say, okay, I have the resources and the tools that I can make the appropriate decision.
Definitely, definitely. It was overwhelming at first. It was like, do I want to do this? Am I old enough to do this? Is this the right thing? But you just have to say, you know what? I'm prepared. I know what I can do. Um, you know, it's not an acute situation. So if the plan changes tomorrow, that's okay. I could always call the patient to tell them, we're going to postpone X, Y, and Z or try something else. That's always an option too. But I was really proud of myself. I
As
really,
you should be.
yeah.
So that leads me into asking about imposter syndrome. I
Yeah.
remember that feeling that first year I was out of school, I kept waiting for somebody to tap me on the shoulder and say, "What do you think you're doing?" How do you
Mm-hmm.
feel? Do you feel like you had imposter syndrome? Do you feel like you still have it?
Totally, totally. It comes and goes. I think it ebbs and flows really because I just have moments where I know exactly what I'm doing, and then I get a really difficult case or something where I'm not familiar and I'm like, "Oh, I need backup. I need help. How do I move forward?" And I always personally, I just started with erring on the side of caution. So if I had a patient coming in and didn't really know exactly what to do, I felt like they shouldn't follow up with me in 1 year. I felt like it should be a little bit sooner. I just have them come back in sooner to see me because might as well just err on the side of caution, have them come back in, go over a plan again. At that time you can consult other colleagues if you need to, and just, keep them close and reassess on those difficult patients or, items or diseases that kind of get you a little confused on what to do and how to move forward.
And we know that a lot of our patients, they're not textbook, they're not straightforward. So that's
Mhm.
great, great advice to give them. But what other advice might you have for a new nurse practitioner who is experiencing imposter syndrome to help them kind of transition when they transition through that more advanced role? Do you have any advice for them about that imposter syndrome?
I think just try to find the confidence in yourself that, the program you went to tried to prepare you the best you could. You dedicated hours and hours to studying, and, knowing this information, and you passed your boards, and your boards helped you prepare, and you wouldn't have passed if you couldn't do the job. And just knowing, like we had talked about before, knowing where to find the answer, you don't need to know it. And accepting that as well, just accepting that you don't know everything and that you just need to be able to help the patient to your best ability, help them find the answer. And just relying on your fellow, APPs, nurse practitioners that you work with, even your nurses. I rely on my nurses every single day who are in my office to help me. It doesn't matter, whether they're the MD, whether they're the NP, the RN, we're all a team and we all try and find the answers together.
That's great. And it is so important. And I always tell people that even though you graduate, we all graduated from these very rigorous programs, but that whole first year is really that year where we expect you to ask questions, that we expect you. When you don't ask questions, I start to wonder, do they really know everything, or they think they know everything? What is it that they don't know? They don't know.
Yeah, yeah.
So what do you find, or maybe did you find anything that surprised you about transitioning from the RN to the NP role?
I think about how helpful, um, for me personally, my supervising physician, how helpful they were helping me, transition into this role, because it wasn't me just learning, like my specialty specifically, but it was learning how to be a nurse practitioner as well and how to take care of patients. Um, and also in myself, just seeing how the role of a nurse and a nurse practitioner became one, because I will never be able to lose my inner nurse inside of me. I never will be able to. And I went to a holistic nursing program. I believe in helping heal the mind, body, and the spirit all in one. And it's just kind of seamless how it happened, how I took, that strong foundation of nursing, brought it into my new role as a nurse practitioner, and how I try to do that with patients, taking the time to listen to them, talk with them, doing a full, examination that I can, and coming up with a plan.
And it's so true what you said. You never forget about being a nurse. And I think that's what makes us so unique in the healthcare team, that we bring the foundation, as you said, to that role, and we never stop being nurses.
Hmm.
I know that there's a lot of times that, a patient will come in and I'm asking them questions and I realize there's something going on, and I'll just say, what's going on today? And they break down, they start crying. And what's the best thing we can do? Therapeutic touch. Go over,
Yeah.
hold their hand, give them a tissue, and just kind of talk about what's going on. And as nurses and bedside nurses, that was one of our strengths, that we were able to comfort our patients in a way that a lot of other people couldn't. So I'm delighted to hear that you still maintain all of the holistic nursing that you learned at QU.
Yes.
So
Yes.
I want to move into more of the professional development side
Okay.
of being a nurse practitioner. Now, nurse practitioners typically choose their focus when they apply to a nurse practitioner program, whether it's primary care, PD, acute care. Where do you, or what do you see in terms of some of the common career paths for new nurse practitioners, maybe not only for yourself, but maybe your colleagues, what they might have done with their primary nurse practitioner degree and what they're doing with it now?
Yeah. So a bunch of my colleagues, the nurse practitioners who I work with now, there's an array, of us, all from, FNP programs or adult geriatric nurse practitioner programs. A couple of my colleagues from, my graduate program as well. A lot of them took their nursing background and, found a joy for that. I had a few friends who were working on orthopedic floors and trauma floors as nurses. Um, and then ended up, pursuing a specialty in orthopedics. And that's, where they're working now. I had a couple of colleagues who loved skincare and loved their skincare routine, and now they're in dermatology, thriving and, learning all of that realm as well, and that specialty. And then I, still had some friends still in primary care. And I think it really just boils down to, experience at clinical, like seeing certain cases that you're interested in, certain rotations that, you seem to thoroughly enjoy. I know one of my colleagues didn't want to go into pediatrics, but then had her pediatric rotation and ended up loving it. And then just tried to pursue, a position as a pediatric nurse, family nurse practitioner.
So you're a family nurse practitioner by education, right?
Correct. Yes.
And you are working in what specialty now?
Urology.
Do you find that the foundation that you had working in primary care has carried over and given you some of the tools that you need to work in a specialty practice?
100%, 100%, because I have patients coming in with an array of, comorbidities and on, a list of different chronic medications. And their concern all the time is, oh, is this medication going to interact with this medication? Or, um, oh, I'm going to see, so and so for this specialty and this blood work. So you need to really get a good foundation on, you know, the whole entire patient, you know, no matter what specialty you're in. And then also just gathering a history, like we said, you know, running through, you know, what's going on, how long has it been going on for, what have you tried? And really, if you're well-rounded with a full, you know, primary care background, you'll be able to handle, you know, a specialty problem with more education, you know, and you'll be more prepared for having that discussion with a patient.
That's great. So what advice would you give to our attendees tonight on the best path that they can find for their individual goals where they may ultimately end up?
I would just say be open, be so open to everything. You know, of course, go through your clinical rotations, looking at specific cases, specific patients, seeing if there's something that interests you, something that doesn't. Even if you don't get to learn what you like, maybe learn what you don't like or what you know, maybe can do without. And I was wonderful enough to have, you know, one of my professors say, "Hey, Jill, you know, do you want to try urology?" Because I needed a specialty in my program, a couple clinical hours in a specialty. And I said, "I know nothing about urology, but sure." And so I ended up going to a clinical rotation, really got along well with the nurse practitioner I was with, and then just kind of ended up in urology now.
That's wonderful. I know that
Yeah.
I was a GYN oncology nurse and I went to go work in gynecology right after school. It was just a natural extension
Hmm.
of what I had been doing as a nurse. And after a few years, I was starting to feel like, you know, I don't know that I can do this for the rest of my life. But like you said, you bring these skills, and I was able to bring all of that GYN care into primary care, which was a great skill to have. So
Totally.
I always say your first job is not necessarily your last. So,
Yeah.
like you said, be open to the possibilities.
Yeah, and that's what's
So
wonderful about nursing too, and being a nurse practitioner is that the world is your oyster and you can always, you know, transition.
it sure is. And wherever you are, you will always bring that experience with you. So, like you being in urology, if you end up in gynecology, oncology, or even about going to primary care, that's a skill set that you will always have with you. So, how about continuing education? You know, as nurse practitioners, we have to make sure we stay on top of our CEs because those 5 years go by like a flash. So, how important has continuing ed been for you up to this point, you know, 1 year out?
Very, very important. Specifically in urology, you know, a part of my you know, onboarding process and orientation were some online videos just to become familiar with some common diseases and treatment pathways. And, you know, I'm earning CE, you know, by doing those. And it's preparing me for future visits. It's building my educational foundation, but also keeping, you know, us up to date on protocols and guidelines that are consistently changing.
Good for you.
Yeah.
So, again, you're a year out now. Do you have any strategies about how you stay up to date with the requisite number of CEUs that we have to do annually so that you're not scrambling at the end of 5 years saying, oh, you know, my goodness, I have all these CEUs I have to do. What are you doing to kind of stay ahead of that?
Yeah, yeah. So really right now, just in my first year is I have a list of different videos from, you know, our national board. So I'm just going through each video, you know, a few a month. Really, that's my goal is just to try and do a couple a month whenever I have some free time in my office. And really just, you know, I have weekly meetings with my supervising physician too. So we're always going over guidelines too, or I'm asking him questions. And if I have a specific case or something that I want to learn more about, I'll take it upon myself to make sure I go over that video, whether it be, you know, kidney stones or something of that nature. You know, I'll say, oh, you know, I want to learn a little bit more about that this month or this week. You know, let me add that to my to-do list.
Nice. So you've mentioned a couple of times that you have really supportive physicians and other colleagues in your practice. Let's
Mhm.
talk about the role of mentorship
Yeah,
in the NP career path, because you know that I'm really big about mentoring. But
yeah.
first of all, how do you feel about the mentors in your office? And then I want to talk about what advice can you give for our attendees about how they can find and cultivate some strong mentoring relationships.
Yeah, I'm a firm believer that you can do anything. It just is a matter of who you're doing it with. That's how I felt, working at the bedside as a nurse, especially with difficult patients. I had a great team, and that's what I looked for in a job. When I was going through the interview process, they were interviewing me, of course, but I was interviewing them.
So important.
I was, seeing if I could get along, with the nurse practitioners and the surgeons and, supervising providers who I was working with. Um, of course, we would talk about medicine and the job and whatnot, but we would also talk about our life. And I ended up just really, I was just so lucky because my supervising physician is wonderful. Again, we meet weekly. We just really got along from the beginning. One of the lead nurse practitioners and I are just very similar, and now we're really good friends as well. So I think my biggest piece of advice is just interview them as well and make sure you're going into the office, seeing how they interact with patients. Is that how you align? Is that how you want to interact with a patient? Because that's how you're going to be taught to interact with patients and take care of them.
Exactly. So how is it? I know that you had interviewed for a couple of other positions.
Yeah, yeah.
Did you find that right off the bat, there just wasn't good chemistry when you were doing interviewing out? Because I always tell people you really should interview and spend some time there because you just don't know. And, spending a half hour, 45 minutes in an interview, everybody's on their best behavior. It's not
Totally.
until you actually get in there. So how was it when you were interviewing at some other places and talk about that chemistry a little bit or lack of?
Yeah, I interviewed at this one smaller private office, and the surgeon was very quick. Our conversations were quick, the visits were quick, everything was like da 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 da. And then he was already telling me about how I was going to be seeing my patients on my own in a couple months before I even was offered the job. And I was just like, these are a million red flags coming out of every direction, and you just have to trust your gut and go with that initial feeling. I just walked in, I was overwhelmed, and I was saying to myself, I'm a brand new nurse practitioner. There's a lot of um, orientation and growth and support that I'm going to need. And I did not see it. And it was really just that one provider. And I like to work with a team, of people. And I just wanted to know that I had folks from, every direction who were willing to support me. And I just didn't feel it then. So go with your gut, trust your gut.
Good advice. And how does it work now? Let's say you're in seeing a patient and you have a question. Do you excuse yourself from the room and then do you knock on the door of one of the providers? Do you have to wait for them to come out of the room with their patient? How does that work?
Yeah, I think it would be very situational. It depends on the acuity of the situation. Of course, I had a patient um just the other day who was actively having episodes of gross hematuria, blood in their urine. And I know that the provider I work with likes to, scope them while they're bleeding. So I waited for him to have a moment to say, hey, I think, you need to see this patient today. And that was able to work out. But we also have, our secure chat system online if I have to ask a quick question, or I could, use a Tiger text if I needed to. Or I would just, see the patient and say, you know what, I'm going to consult one of my colleagues. I'll get back to you, later this week with a plan, and I'll just end up calling them later that week or, discussing it further. So I really think it depends on the acuity of the situation because, of course, I want to respect their time because they're seeing patients as well during the day.
Sure. So it really is by case basis, but you said something very important about how the one of the interviews you went on, when you get that gut feeling, you have to run with it because if they're showing that at the interview, you have to wonder, is it going to be week one and they're going to be out of the office doing procedures or rounding at the hospital and I'm going to be all by myself as a new grad.
Totally.
When you started in the office, were you on a reduced schedule? What did they do like, from the beginning until now?
Yeah, so right from the start, I was only shadowing. So I did not say, I really didn't do much with the patients. I was only shadowing. Then it kind of filtered into, okay, I would see one patient a day and write a full note on them, with a full plan. And then it just progressed, to me seeing about 4 to 5 patients a day on my own, with a provider with me, writing notes. Um, And then initially, when I started to see patients by myself without a supervising provider, I would see all my patients' visits were an hour long. And I would have, I think, a maximum of 5 per day, for a good 2 months, a good, month and a half. I would see, about 5 or 6 patients a day. And then, we had a follow-up meeting. They would ask me how I was comfortable, what I was comfortable with, what I was uncomfortable with, what I still needed to work on. And then we just kind of, upped my schedule until I was, fully running. But of course, it was, with the approval of myself, with my manager, with my supervising physician, and just, catching my pace and seeing how I was doing.
Nice, good. It sounds like you landed in the right place.
I totally did. I totally did. Everything happens for a reason. I ended up in urology somehow for a reason.
Good, good for you. So, I would like to kind of dovetail onto that about some advice that you can give on different challenges. So, as a new nurse practitioner, what are some of the challenges that you see as a new, I don't want to say a new grad, but as a new nurse practitioner? And what advice would you give to help people overcome those obstacles?
Yeah, well, probably the biggest challenge is, facing you're already a little self-conscious and not fully confident in yourself when you're going into a room. But when you see a patient who says, "You're not the doctor. I was supposed to see the doctor today," that's always kind of shattering because you just are trying to be so confident in the room and give them the best. But I think it's just a matter of trying to be, confident in yourself, learning how to explain what a nurse practitioner is to people because not everybody knows what a nurse practitioner is and what you're capable of doing, which is very similar to what a provider, a medical doctor is, in the office. Um, and just, being able to um, support yourself too in the moment because I've had a lot of patients who've looked me up before and said, "Oh, I saw you just graduated this past year from this school." And you just have to be confident in it and say, "Yes, I did. I'm so excited to be here. I've been seeing patients on my own for, 8 months now." And, just running with that, and just being fully transparent at the same time.
And we all know that our patients do their homework on us. They Google
They do.
everything. I have a patient every year that comes in to see me, and he always tells me that he always still, and he's been my patient for probably 10, 15 years, and he still says to me that he still looks up to see what my reviews are. After all these years. And I said, okay, as long as I'm doing the good job by you. And I have to tell you, even after 26 years of doing this, in the beginning, I used to hear that all the time. Well, you're not a doctor. I really want to see a doctor. And we had a lot of resistance back 25, 26 years ago. And to this day, I still get it. As seasoned as I am, I see a patient overflow for somebody else and let's say, well, I really wanted to see Dr. So-and-so today. And the advice I would have for all of our listeners today is to just say, we're going to get that. I have a doctoral degree, but I'm not a physician. And I always say to the patients, how about if we get through the visit and I'll be sure to make sure that your primary provider knows exactly what went on today. And if you're still not happy, then you can come back and see them. And I have to tell you, I don't think that I've ever had a patient come back and say, no, you didn't do the right thing. You're always going to get some patient that's not going to be totally happy, but I think they are probably less nervous now than they were, say, when I graduated. I mean, I have to say that was probably one of our biggest challenges was to get patients to really accept the role of the nurse practitioner. What do you think might have been, I don't know, maybe your most difficult or challenging piece of transitioning from RN to NP that we haven't already talked about?
Hmm. Probably just probably, recognizing that I still have that nursing background, but learning that in this role as a nurse practitioner, I am not the nurse. So learning how to delegate, learning how to, ask ask my colleagues, to do things like I can easily, of course, go put a Foley catheter in a patient, but that's not my role in the office. I have to ask the nurse to do that so I can do the number of other, responsibilities and duties that I have to do that day. So really letting the control factor go I think that that's really difficult as a nurse.
But delegation is something that is a learned behavior.
Yeah,
So
yeah,
it's so, and it is so true. I've had nurses that say, well, you know how to draw blood. Why can't you do it? Again, because that's not my role. I have patients that I need to see.
yeah,
So that was great advice.
hard.
So I want to move into a little bit, and I know you and I have talked about this, about, work-life balance and the importance of it. I know that you're planning a wedding that's coming up, I believe in about 30 days,
Yes,
that you have
yeah.
other commitments in your own life. Can you talk about how you nurse practitioners can effectively balance the work-life integration, especially in those really demanding early years of your career?
Yeah, it's hard. It's very, very difficult, especially especially because this first year is just, it's so transitional. There's a lot of education. And it's a lot, it's exhausting because your brain is just on overload all day trying to absorb so much information that you get home and you basically don't have the energy to do the other tasks that you might want to do, in your normal everyday life, whether it be cooking dinner, being with your children, bringing your dog for a walk, or planning a wedding. Um, but really, what I tried to do was prioritize my time and delegate my time in, areas that needed attention. I knew when I first started my job that was my priority. I wanted to focus on, work. I wanted to focus on some extra education that I was doing on the side for work. So I really prioritized that. But also, delegated, certain time on the weekends for family or friends or, planning my wedding. So it's really about, I really laid out my schedule. I'm very type A as well, if you couldn't tell. So I really laid out my schedule and said, okay, this time I'm going to dedicate towards, work, but this is really for family and friends, and this is for myself. And, having a good, handle on all of that, I think really helped me, provided me structure. So then I didn't feel guilty if I was with my friends. It's like, well, this is my time that I built in to be with my family. So, yeah.
Sure. And why should we feel guilty for not doing work? We have to let go of that.
Hmm.
So I know that time management is an issue for a lot of people. Time management is one of those things that is very hard to teach people, but
Yeah.
with electronic health records and starting your own practice and being able to have that work-life balance, can you talk about how you were able to handle that so that we hear from so many people that they go home at night and they spend 2 to 3 hours charting, and that's not me. My
Yeah.
charting's done at the end of the day. But
Yeah.
what did you do to help prevent doing work after hours?
Yeah, I never initiated working from home, not once, and I won't. I did my own education on my own, online videos with little notes that I took on the side, but it had nothing to do with actual, patient cases or anything of that nature. And I really want to thank you for teaching me great time management. I would like to thank, one of the lead nurse practitioners who I work with. She was wonderful in orienting me, and she flat out said there are nurse practitioners here who take work home and do it at home and pre-chart at home. If you would like to do that, that's all you. But, I have other priorities. I have other responsibilities in life. I do not bring work home with me. And that is something I truly stand by. So we use Epic at my office. And so I have built in templates for, patients who are new consults or patients who are a follow-up visit. Um, I use dot phrases a lot of the time as well. And it's really just learning how to be tech savvy. I had, someone from our tech team come and work with me for a full week and really teach me, certain little dot phrases or quick actions to do online. So just becoming comfortable with your electronic medical record will already get you ahead of the game. And thankfully, with my education from not even just the individuals who I work with, but when I was going through school as well, like yourself and charting and whatnot, just really, really prepared me for working in the real world.
And it's so important, like you said, the biggest takeaway is spending that time developing your template, developing your dot phrases. If you're not a fast typist, maybe asking your employer about getting the Dragon system. And now, of course, we have AI. AI is, like it or not, it's here to stay. And we just had something a couple of weeks ago. We had a big meeting about AI, and some of the clinicians in my office are now using AI for documentation. I haven't made the leap yet because I haven't worked with anybody on it, but have you worked with AI yet with any of your documentation?
No, no, I use the Dragon all the time. And we had one day where the Dragon wasn't working and I was humbled. I was like, oh my gosh, I have to type my whole note out now.
I know.
Yeah, yeah.
Yeah, that's the problem with tech, is sometimes if something goes wrong and
Mhm.
we've become, it's amazing that it's only been 10 years that we've been using electronic health well, a little bit over 10 years. But when that goes down and suddenly we have to do everything by pen and paper, and I'm thinking my hand is killing me. I need to start typing.
Mhm.
So that is so true. We have to become tech savvy. And for those people, like you said, that you actually worked with somebody for a whole week, was that something that your practice offered, or was that something that you requested? Like, what can our attendees take away from that?
It was a part of my onboarding process. As a new provider for the office, they had someone, it's called, like elbow support that came to help me. And just she was watching me, watching everything I was doing with charting. And then she would say, okay, let me help you with something. This is a quicker way to do it, or, this might be easier. And it was phenomenal. So it was not something that I requested. It was something that was, built in. So that's always something to look for as well when you're looking for jobs, how they support you, even after your orientation.
Right, because you don't want to get in there and perhaps like you were already on Epic, having been in my office, so it was probably a lot easier. But imagine somebody who is in clinical rotation. Some of our attendees might be those people that might have been in there, and maybe you didn't work on Epic, but you worked on something else. And each one of the electronic health records are vastly different. And they don't interface with one another. And so there's a huge learning curve. So I would advise anybody who's listening today to make sure that you put that on your list of things to ask about what kind of support you'll have, tech support that you'll have if you're learning a new system.
Hmm.
Good.
Definitely.
So I want to talk a little bit about, how I feel about cultivating tomorrow's nurse practitioner leaders, because I think we talked a lot about that. What advice do you have for new nurse practitioners who are thinking about pursuing a leadership role? Maybe not that first year out of practice, but something that they think about in the future. What
Yeah.
advice do you have for them about pursuing those roles?
I that's awesome because that's so me too. Like I totally would love to do that, in the future of my career, but I think it's important to really build a foundation. And I think I stick to those words because, being a nurse, I was a bedside nurse for about 6 years before coming into the role as a nurse practitioner. And I think if I didn't have that experience, I wouldn't have the strong foundation that I believe that I have right now as a nurse practitioner. And I really think that if you develop, your strong foundation as a nurse practitioner too, you'll even be a stronger leader, and be able to, lead your colleagues, whether it be for, a national board or within your organization. I think it's, absolutely wonderful, especially with our nurse practitioner knowledge and how we do feel that we help the patient's mind, body, and spirit all together. But again, I think it's important to have that really strong foundation too, and just the confidence in yourself as a nurse practitioner.
So true. So true. So how do you think nurse practitioners can build that strong professional network to help advance their careers leading into some type of leadership role?
I think it's staying in touch. Like I stay in touch with you, and thankfully I do so because I'm able to be here and, talk today. And I think it's just meeting, the people that you cross paths with, whether it be from your program and clinical or, going to different conferences for, um, eh, your national boards or your state conferences. I think all of that, you network through who you meet, and just staying in touch with them, and you'll be provided different opportunities, and you know uh following through with those opportunities, and maybe it'll lead you to another open door that you didn't know was possible.
And there's a lot to be said for the whole networking. Like you said, start like maybe with your state organization. And for those of you that are on tonight, It's so important. If you're not a member of your state nurse practitioner organization, I would strongly encourage you to join. It's a great way to support, obviously, the nurse practitioners in your state, but a lot of part of the fees for belonging to your state and national programs goes to pay for the lobbyists who then support us in our nurse practitioner practice, especially if you're going for full practice authority. And it's really important because you start to meet people. So many of my friends now are nurse practitioners that I have met throughout my entire career. And now we actually look forward to it. And you know this, that we go to conferences together, and it becomes a really big thing because we look forward to once a year getting together with our nurse practitioner family and just being able to reunite with people who kind of think like we do, and just like-minded people. So great, great advice. So do you have anything else that you want to add before I take a look at the Q&A here, Jill?
Probably not. I guess one thing actually I do that one of my colleagues who helped orient me taught me was just be a sponge, because I was so overwhelmed. My brain was on overload. I was like, how am I going to learn all of this information and see patients on my own and know all of this? Just be a sponge, absorb as much as you can from everyone. You're going to learn different ways to run your practice from different nurse practitioners that you meet through work, through clinical experiences before, from different physician's assistants or MDs, and just take it all with you and make the most of it and just try to, absorb what you can from everyone.
Great advice. Take the best from the best, right?
Yes, yeah,
Excellent.
exactly.
Okay, so I'm just going to take a look here and see, do we have any questions in the, Joanna, do we have any questions that I need to look? Oh, here we go. All right, so let's see. One of the most difficult areas I hear from many NPs is the time constraints and expectation to see X number of patients. How did or are you moving through this challenge? I'm going to let you answer that, and then I'm going to give you some advice.
Yeah, so that was a part again of my interview process. I wanted to know what the expectation would be of me when I was fully up and running, how many patients they expected me to see, how long the visits were. Something new that my organization recently incorporated was 45-minute new consults. So that was something I developed into my template, and then all my patient follow-ups are 30 minutes. I think it's important too to see how much admin time you have, time away from your patients and what you can be doing, to manage prepping your charts, but also your in basket. I think that's something that we sweep over a lot, is you have to manage all of the labs and the ultrasounds and imaging that you order, and patients calling in saying that they don't feel well, and want follow-up. So, really just laying all of that out, and doing what you're comfortable with. If you're not comfortable seeing, X amount of patients that day, then maybe keep searching for a job where you feel more comfortable.
And I always say that we advocate for our patients. Why do we not advocate for ourselves when it comes to our jobs?
Mhm.
So, and again, if you don't speak up, if you happen to go to a practice and you're interviewing and they say you're going to see, 15 patients right out the first week that you're there, you might want to run, because that's going to put a lot of pressure on you as a brand new grad. And you really had a great situation where somebody worked with you for a little while, then you transitioned to seeing a few patients, and then it kind of grew from there. So that was really great advice. So
Totally.
this is one of my favorite topics to talk about is, did you find it difficult to negotiate pay as an NP? I feel like when you're an RN, this is not something you usually do when you're offered a job at the hospital. Do you ask for an hourly rate or salary? And did you find this challenging?
100%, 100%. I felt the same way. I was like, I've never negotiated pay before in my life, because this is what an RN makes, and this is the, hourly rate and, night shift differential. I get it. I get it. So each organization will tell you if you're hourly or salary. Specifically, I am salary rate right now. And it was challenging, but you know what? I applied to, my interview process really landed with 3 different organizations, and um I specifically said, this is what I'm being offered somewhere else. So this is, this is what I want. And I really compared all the packages. I waited until, I heard back from different organizations and compared, of course, my salary, if there was any type of sign-on bonus, of course, your PTO too, how much time you get off and sick time. So really comparing the whole package. And then, of course, I rebutted and I said, this is what another institution is offering me. What can we make work? And, it was a negotiation and a compromise, but, you got to start somewhere.
And it's really hard because, as you said, as nurses, we never had to negotiate. So the advice I would have is to do your homework on comparative salaries. You obviously did that, Jill, because you knew what the average rate was in this particular area. So you need to look at a couple of different websites. Things like the salary.com is one place to go to. There's a couple of other websites that will actually do salary negotiations or not salary negotiations, comparative salaries for you. You just have to kind of do an internet search so that you can get an array of them to see what the average is, because using just one website is not a good idea. You have to go to a few different ones and then take an average of that. And you just have to be really strong in your negotiation skills. One of the things that I always tell people when I teach about salary negotiation is that you'd never pay sticker price for a car. And most of the time, although we're in a very different era right now, but most of the time, if you're looking at buying a house or a condo, you wouldn't pay the asking price. You usually, ask for something less. So if you're not going to do that in other areas of your life, you're not going to do it with your salary. And if you do, then you're going to probably be really upset if you didn't do your homework and find out later on that you're being paid way less than what the average nurse practitioner is paid in your particular area. As primary care providers, we get paid very differently than specialty. Specialty tends to pay a little bit more because they charge more and they make more money in the practice, which is why it's so important to do your homework on those comparative salaries. Somebody put in here, what are you finding in terms of new grad pay? One of the things you have to remember is you can't really compare your RN to your NP salaries. Okay, RNs are higher in demand, that we know that there's a nursing shortage. There's lots of sign-on bonuses and there's shift differentials and weekend differentials and bonuses if you sign a contract to work a specific shift. So your RN salary is going to be very different. And I always ask people, did you become a nurse practitioner because you wanted more money? Like, why did you become a nurse practitioner? Because if you're just looking at the salary, then you became a nurse practitioner for the wrong reason. But you have to think about the autonomy in being a nurse practitioner, all the things that we spoke about earlier. You need to think about the fact that there's no nights, weekends, and holidays that you're expected to go in and see patients at the hospital. So there's a lot of different things that come into play when we start looking at salary, and salary is completely independent of benefit package. So, do again that your homework on those comparative salaries. Somebody put in here, do you recommend a professional resume writer prior to applying for jobs? And so the thing is, if you don't have a good CV or a good handle on your CV, find a good person, but find it from somebody who has worked with, that they've actually used a company. I have to tell you that, I wanted somebody after all these years to look at my CV differently, even though I do this all the time. I just wanted somebody else to look at it. And I ended up having to correct all of her mistakes. And it was a very expensive lesson for me to learn. So just go with somebody in the industry who has actually used a professional resume writer. Jill, I'm going to throw this question to you. Can you give any examples of red flags to watch for?
I assume that means like through the interview process.
I would assume so, yes.
Yeah, okay. Red flags for me personally, I was very insulted when I got one offer that was few days of PTO, because it's different when you're working 12-hour shifts as a nurse and you're getting, a lot of different time off or working certain holidays and not you're going there Monday through Friday from 8 to 5 or 8 to 4, and you want to know how they are going to treat you long term and how they're going to treat your employees. And I really think it's, just feeling like you feel welcomed, feeling like you feel wanted, not just needed, but wanted, to be a part of the group. And just knowing that they're going to support you. Not only when you are finished as a new graduate or finished with your orientation, but once you're, running as a practitioner too. And just, I really think, again, it's really about your gut feeling. It's not necessarily just one thing that will happen, but it's how you feel in the office when you're there.
And you said something really important about you're working there 8 to 4, or whatever your hours are. Did you negotiate for your admin time? Because one of the most important questions you need to ask when you're interviewing is, are you seeing patients from 8 to 4, and then are you expected to document on your own time after that? That would be a huge red flag.
Yeah, yeah. So unfortunately, I could not negotiate on my admin time at all. I get 4 hours a week, and then I get an hour lunch break as well. Um, it might be the nurse in me, but I work through my lunch hour. I think a lot of, folks do, going through their in basket and phone calls and whatnot. I take a good 30 minutes by myself. I go on a walk every lunch. But the other 30 minutes I'm sitting by my computer. But yeah, I think it's just a matter of, diving into it, seeing how comfortable you are. But what's great, is I have, a nurse practitioner, board and team within my organization. So that's always something we're fighting for, after even, being established now, just seeing if we can all get that for the future. Cause I know that's something that we all want. You might be done at 4 o'clock, but your last patient's at 3:30. So you have to stay until your note is done and the visit is finished.
Right. And so the way that you can work around that is maybe you get your last patient at 3:15, because we know that patients show up late. They come in with more than one problem, and that 15-minute visit turns into a 45-minute visit. But it is so important. And 4 hours of admin time is about the average that everybody gets across the country. But that we might see a shift in that with AI. And so, stay tuned. 4 hours is kind of the average now, but stay tuned. That could change at any minute. Somebody is writing here, are there any clinical apps or books that have helped you this first year of practicing that you would recommend?
I definitely love my Epocrates app. I use that all of the time to research medications. My institution on my computer, I can use UpToDate all the time. I'm always looking that up as well. And, the American Urological Association I use all the time, which is my, specific guidelines that I follow. So I think it's just dependent on, where you're at, as well, if you fall into a specialty versus, primary care. I can't speak, more highly enough about, the Margaret Fitzgerald, exam prep book. That book got me through. That was my knight in shining armor. That book, it got me through all of my program. It got me through my boards, and it just made me feel confident. And I still have it, and I still refer to it, and it's sitting in my office right now as we speak. So,
Of hearing that.
yeah.
The other app that I would suggest is I also love my Epocrates, and I have no financial affiliation whatsoever with them. But the other app that I find incredibly helpful is the Sanford Guide. That I find great, especially when I get that urine that comes back that has some kind of bacteria in it that I've never heard of before. It's a wonderful, very intuitive app. So that would be another one that I would suggest that you have. Holly is asking, what is a good orientation time?
I think mine was a couple months. I want to say mine was from December until I started seeing patients on my own in February. So I think I had a solid like 2.5 months, about 12 weeks-ish, maybe 11 weeks. And I felt like that was okay. I felt towards the end, I was able to really know what I was doing with the patients. I had a good foundation, and a part of it at the end, you just kind of want to be thrown into it just so you can learn, because that's how you're going to learn, is with different experiences. You're going to get the cookie cutter visit with your supervising physician, but then you're going to get the really confusing case when you're by yourself. And the only way for you to figure it out is for you to go through it and actually try and figure it out.
Excellent. All right, and we have one last question here. How do you handle an interview when you are visibly pregnant and the physician tells you that the pregnancy is a problem for his or her practice? So I have to tell you, it's really against the law for them to say anything about your pregnancy. And if a physician is already telling you at the interview that the pregnancy is a problem, I would tell you, go look somewhere else, because if the pregnancy is a problem, what's going to happen when the baby gets sick? So I would just take a look and maybe look somewhere else. There are jobs out there, and if there's not jobs that are being advertised, I always advocate for you to create a position of your own. I have to tell you that every position that I have ever held in the 26 years of being a nurse practitioner was never advertised. My first job out of school, it was really a tight job market here in Connecticut. And my very first job was with one of the docs that I was working with on the unit. She knew me as a nurse. She asked me one day what I was doing for work. And I said, I don't have a job. You want to hire me? And she goes, I was thinking about hiring a nurse practitioner. And that was my first job. We went out to dinner, we hammered out the details, and I worked there a couple of days a week to start, and I taught on the side. So there's other jobs that are out there, and your pregnancy should not be a problem for any practice. So that's all we have for tonight. Jill, I want to thank you. It was so great to connect with you again. I'm so proud of you and all that you have accomplished. And I can't wait to see what the future holds for you. And I want to thank everybody for being here tonight. We really appreciate your interaction with us and your really pertinent questions. And if anything else comes up, certainly you feel free to email us, and we're happy to answer those questions for you. So I'd like to say good night to everyone. And until next time, thank you.
Bye. Thank you so much, everyone.